blood vessel formation. In terms of the paracrine activity, as you mentioned, like an exosome and extracellular vesicle, you are exactly right. The cancer cells can just transfer different bioshuttles and different cargoes, different growth factor via these monocyte particles and make some active cell-to-cell interconnections. So even that by sending these kinds of the factors, they can just dictate a distinctive behavior on the surrounding cells, and even like a immune cell like T helper cells, they can just circumvent and even make some the shifting and even the circumvent their activity and make some mask on their external surface and just inhibit the invading and provoking to the side of tumors. You are right. Actually, very fruitful comments. Thanks a lot. Okay, Mrs. Bada, as you know, due to the massive changes in lifestyle, the human beings are exposed to different predisposing factors and harmful components that increase the risk of the cancer condition. And in different societies, even in industrious countries as well in developing countries. In support of my notions, if you're going to compare the statistics with some previously released data, and even with the traditional cultures, societies, you can just find that the risk of the cancer will be increased, have been increased by progressing the technology. How do you think about it? Is it true?
Absolutely, Professor. Actually, there are many factors which cause cancer. If we want to categorize them, the first one is the occupational and industrial materials, such as soot. Soot is the first agent which recognized as a carcinogen in the 1975. And after that, we have X-ray. Actually, X-ray in a early radiologists which try to test in their own bodies cause to skin cancer. And then we have some radioactive materials such radium, plutonium, yes,
plutonium.
Something like that. Then we have silica dust, which cause to lung cancer. After that, we have some industrial materials such as arsenic, benzene, formaldehyde, vinyl chloride, which workers exposed with them in different factors. In other hand, we have a lifestyle agent.
So let me just make
Yes.
some concluding remarks. You mentioned that the first and highly important factors because the cancer are chemicals.
Yes,
Okay.
absolutely.
The second one?
Yes, the second one is lifestyle factors, such as eating more red meat and processed meat, using alcohol, smoking. It's so important.
Mm-hmm.
After that, unfortunately, obviously, and stressful lifestyle. Actually, most of us experience this stressful lifestyle and high cortisol.
Yeah, unfortunately.
Yes. And then we have the infectional agent, which can be viral or non-viral agent. From viral agent, we can mention some different viruses such as HPV, HCV, which are hepatitis B and C.
Yeah, papillomavirus and
Yes.
hepatitis virus.
Yes, and then HIV and HPV, which are well known. And then we have non-viral agents, such as some bacteria like Helicobacter, and then have some parasites and worms can cause inflammation and then cause cancer. And finally, we have a natural and pharmaceutics agents. Natural agents such as the ultraviolet radiation, some hormones, or the salted fish, and then we have some pharmaceutics agents such as aflatoxin, which is a poison that extracts from poison mushroom, and then we have phenacetin.
You mentioned the fungi. There are
Yes.
byproducts of fungi.
Yes, yeah, fungi. Then we have phenotoxin, which is painkiller, but can cause to cancer. Also, the chemotherapy and cytotoxic drugs, unfortunately, can cause to second level, secondary cancer.
Induced, cancer.
Yes, absolutely. Knowing these factors help to us to control them in our life, but I know most of them it's out of our control. especially in last recent, which people have more industrial lifestyle with different pollution like air pollution, water pollution.
So the possibility, risk of
Yes.
cancers, cancer will be increased.
Yes, such as microplastic, nanoplastic, which maybe we eating or breathing them every day, and we can control them. And I think it's very scary and worrying.
Yeah, great. In terms of the infectious particle, you are exactly right. In all items, absolutely, you are correct. And so the viral particle and even virons, the active form of the viruses, can just directly they affect the genomic pool and genomic profile, and so make it and activate some oncogenic proteins and oncogenic agents. And even the case of the Helicobacter, as you mentioned, which reside under lamina propria and deep layers of the stomach, and so some of the chronic changes will be that just induce the neoplastic condition. This bacteria could not just directly induce the tumorigenic agent, but by time and by progressing the chronic changes, and increasing local increase some factor like a TGF beta, transform growth factor, but the chance of the tumors will be increased, like adenocarcinoma within the stomach will be increased. Yeah, you're right. Even that the direct exposure to ultraviolet, we have kinds of the ultraviolet based on their frequency and their wavelengths. And so, I don't know, I'm that sure, but I think that two types of them are carcinogenic, even that the protein could be just, directly affected by their irradiation. And hormonal therapy like estrogen, progesterone, which are contraceptive. And we will have some separate discussion session about the hormonal therapy, how this hormone can just cause and increase the chance of the tumor cells expansion. So great. Okay, Mr. Javed, as you know, inside the cytosol in cancer tumor cells, we have some malfunctioned proteins with just altered conformational structure. One of the reasons behind the activated, overactivated situations in these cells is that this protein cannot be inhibited, and so some of the regulatory systems should just control their activation and inhibition and different status, and so it should be just some system control the changes in their morphological and even that conformational status. Do we have any system inside the cells to control this condition or not?
Absolutely. There are some initial factors that are really important in activating the genes that are related to cancer and cancerous cells or metastasis. And to make a long story short, if we zoom out the whole process, we go one step back. We came to chaperones, which are really important and sometimes, misunderstood in this area. Actually, chaperones are the key factors and orchestrators of cancers and any protein-related or gene-related change in our body. These chaperones are, they are part of proteostasis network of cell.
Great.
Yeah, they actually have some important rules, such as controlling the folding of proteins or some growth factors or the maintaining cell stability, and millions of factors that are related to chaperones. Actually, we can call that chaperones are the starting point, the key factors. But also there are some factors that activate chaperones to work. And these are some factors that we usually face in our daily life. To make it general, we can say that metabolic disorders, as friends mentioned, stressors, mutations that happens in cells usually activates the chaperones. Then the story begins. And chapters...
Sorry, I'm going to interrupt you. If these chaperones could not just afford the restoration of the protein function and even the shape, in that case, the cancerous condition will be heavy.
Yeah, actually, when they can't control the cell, when they can't control the misfolded proteins, when they can't stop aggregation of the proteins, it starts. For example, when the initial factors like metabolites, toxins, viruses, stress, and lots of things, radiations, we have pollutions in our daily life, when it aggregates in our body, they can't control it.
And even Farzin, what happened if this chaperone could not just work properly? And what happened then? I mean, I'm talking about, I don't know, protein structure.
Yeah. When they can't stop the changes of protein, I mean the malfunctions of proteins, they misfold, they aggregate, and they accumulate. So the growth factors change, the ratios change usually in cell, and it is the start of the cancer, because the cell loses its stability and also the speed is fastened. So increase in speed makes it tumoric. And generally, there are millions of factors before the cell becomes, mutated and becomes, metastatic. There are lots of levels we may have in next sessions.
Yeah, great. And this misfolded protein in some cases have prolonged longevity because they could not be hydrolyzed by lysosomal system, and they have the enhanced lifespan. So even that some changes in their structure, conformational alteration, because they're providing some the site, how can I say, some of the active sites to their downstream effectors. It can accelerate some biochemical reaction, and then you know what happens.
Yeah, also there are some special kind of chaperones called heat shock proteins, and especially 4 of them are really important, HSP 90, 70, and HSP 27, and also GRP 80. And if the chaperones, if these lose their control, the gathered and aggregated proteins usually helps the cell to survive. Actually, this is the problem that happens. The factors, affect the chaperones affect the misfolded proteins, and these proteins change the expression of genes, and this is the start of the whole story of cancer.
Great, thank you. Thank you for your comments. Mrs. Ojali, as you know, almost all types of the tissue in our body can be cancers. And so after occurrence of an initiation of the cancer conditions, different cells and different lineages can be provoked to the cancer parenchyma. So we exposed to different cell types which residing within the tumor mass. But in the clinical setting, we use just some drug, targeting the cancer cell. And so by these cells have inherently their own resistant mechanisms. And we have other cell types within the cancer parenchyma. So in the majority of the time and the majority of the cases, our therapeutic protocols are ineffective. So how do you think about it?
First of all, I'm thanking you for having me as a new member.
You're welcome.
As you told me, there are different reasons for different types of cancers, and different risk factors, different even 2 people with the same tumor has different profile in their genes and the environment of the tumor, and there are other problems too. For example, we have chemotherapy. When we use it, it can kill the tumor cells, maybe, if it's effective, but it can also kill our normal cells as well. So and we had a workshop with you, Professor, yesterday, and you talked about the solid tumors, and you said that it has different layers of cells in one solid tumor. For example, the center of it is necrotic cells. They die because of the low nutrition and the low oxygen, and but the cells around them, they used to know how to survive in that circumstance. So they are educated. They get educating. So and if we use one method, for example, it may kill some part of that tumor, but some of them will be untouched because they know how to resist in that circumstance. So, and as I told you, we have another problem. Different patients have different profiles, and